Good afternoon. My name is Jen Salkin from the Benjamin Rose Institute on Aging, and thank you for joining us today for COVID and Quarantine, the Mental Health Consequences. This program is part of our series of virtual programs for caregivers that we provide each month. This program will be recorded, and I'll be sharing the link with you all in an email in the next few days. So please feel free to share that with friends and family who are unable to join us today. We're going to have a lot of information to cover, so we will hold all questions until after the presentation. However, you may submit a question at any time using the control panel on the right-hand side of your screen. Before I introduce our speaker, I'd like to tell you a little bit about Benjamin Rose. For those that don't know, we are a Cleveland-based nonprofit founded in 1908. Our mission is to support caregivers and empower all people to age well through research, consumer responsive services, and client advocacy. We provide a variety of services and supports to help people age well in the community. That includes behavioral health services, which you'll hear more about today, social work, counseling, and coaching to help people achieve financial wellness and housing stability. We also operate the Rose Centers for Aging Well, which are our senior centers located throughout the Cleveland area, and we are a Meals on Wheels provider. I'd now like to introduce today's speakers, Tam Cooper and Doug Braun. Tam is the Associate Director of Behavioral Health Services here at Benjamin Rose, and Doug is a behavioral health clinical social worker. I'm now going to turn it over to Tam.
Good afternoon, everyone. Thanks again for deciding to come and listen to our presentation. Doug is, as Jen said, a member of the Behavioral Health Services team, and he's a senior member. He has been with our agency 29 years. He's an LISWS. He's certified in a number of different therapies, and later on he'll be speaking about some of the treatment modalities used PTSD therapy. I wanted to mention a couple things before we get started. One, I'm battling somewhat of a cold, so if you hear my voice kind of get a little rough, I might have to pause and take a drink of water. So I just wanted to let you know that. While quarantine and self-isolation can be two different experiences for some, for our purposes during this presentation, we are using those words interchangeably. Why? Because the experience for older adults, the feelings, the total isolation, and lack of contact is very much the same. In the beginning of this pandemic, I think most of us thought this virus was just going to be a temporary inconvenience, didn't we? A year later, more than 500,000 deaths and lives shattered. We know different. The harsh reality for us is only an open door away. Next slide. What I hope that you all will get out of the presentation today is that you'll be able to recognize some of the COVID-19 and quarantine risk factors roles in mental health disorders, that you may become familiar with some symptoms that link post-traumatic stress disorder and other mental health disorders to quarantine, some ways to cope, and how to help. Next slide. We're going to talk now about some risk factors that link PTSD and COVID-19. You know, one of the strange things about COVID-19, even a year later, is that there are still many unknowns. The unknowns about how the virus started, the new unknowns with the different strains that we're hearing about recently, and even those with the long haulers that we've heard. And certainly how a young person can get COVID, they can be perfectly fine, go in the hospital, and 2 weeks later, they're deceased, or go in the hospital, be put on a vent, and then come out later. So the unknowns are frightening, and the coronavirus still has many. Any diagnosis can take a toll on a person's emotional well-being. Think about it. I certainly can't tell who's listening, but I'm sure you've all been to the doctor, or you know someone who's even had a simple diagnosis, whether it's arthritis, high blood pressure, cholesterol, and we talk about diabetes or cancer. You know, you walk into the doctor's office one way, and then you come out and your world has changed. All these questions go through your mind. What am I going to do? How am I going to manage? How is this going to affect my family, my work? So COVID, it takes a toll on your emotional well-being. For those that get sick with COVID, or those that are thinking about it, it's a very real fear of dying. 500,000 people are dead. Social isolation in quarantine. And then if we're talking about older adults, they had a limited social circle to begin with, just by virtue of the things that happen to them as they age. The anxiety related to the thought of getting sick again. That's one of the strange things about COVID, is you not only get sick once, we're hearing that people are having a second go around. And then what we've heard about is that ongoing brain fog for the long haulers. Hospitalization experiences of either going on event or seeing people on event. The inability to breathe. Some people have mental health conditions already where they are fearful of that inability to breathe. Or if you have asthma, just think about that. Not being able to breathe, how scary that is. So you're in the hospital, you're experiencing that. Sounds of the other patients. Medication hallucinations. I don't know how many of you have had that happen, whether you've been had a bad reaction to steroids, or you've been in and out of anesthesia, or even heavy narcotic medication where you can think that you're seeing things, hearing things. And then, of course, just the depression and anxiety that goes along with being ill and not being able to do what you want to do. So some data already indicates that people diagnosed with COVID may be at a higher risk for mental health issues, especially post-traumatic stress disorder. And you know, when you think about the things I just listed, why wouldn't you be at a higher risk? I want to talk about some things about PTSD that aren't particularly on the slide right now. You know, for a long time, PTSD was sort of an unknown, and it was really not so very long ago when PTSD was only associated with veterans. As I said, I'm not so sure in our virtual world now who the audience is, but I'm of the era born between a World War II combat veteran who didn't talk about the war, and his son, my brother, a Vietnam vet, who suffered mercilessly from something they didn't have a name for just yet. And as a typical little girl, I had a best friend, and we were almost inseparable. I mean, we did everything together, rode the school bus, ate, hung out, spent weekends together, almost inseparable, almost. She would always spend the night. And some nights I had to wake her up, I had to shake her, because she was tormented by these fitful dreams, and I couldn't figure out what they were. I also never knew why she just didn't seem to want to be alone with her dad. Many years later, a good friend of mine had a heart attack, and while recovering at the hospital, she had a stroke. And the doctor said she could understand when we would talk to her, but she couldn't talk. And although she could move her arms about, she wasn't able to, talk or do anything else. So it was early in her hospital stay that she was placed on a ventilator. Well, I received a call from her family the second night after she was put on that vent. And apparently we've learned that during the night, she'd become agitated. no doubt afraid and scared of her surroundings because the doctor said she knew what was going on. But apparently she had pulled that vent out of her throat and died. So while PTSD is a diagnosis for the person, I'm inclined to believe it has an impact on those it touches, an impact that leaves a memory that doesn't really go away. So I hope today, sometime today, you'll take a moment and think about this pandemic, a year in the making. Think about people you know and older people that you don't know. And if you do, I can't imagine that you wouldn't be touched by the thought of what people are going through, whether they've been diagnosed with PTSD or COVID. Next slide. So nowadays, all those symptoms have a name, and it's post-traumatic stress disorder. And we've learned that there's a special category to treat this, that PTSD can follow any traumatic event, a natural disaster like Katrina, hurricanes, 9/11, school shootings, rape, child assault, illnesses like COVID. So the symptoms may include nightmares, flashbacks, disturbing thoughts and feelings related to the event, a deep sadness, fear, anger, feelings of detachment or estrangement, an avoidance of anything that stirs up memories of the traumatic event. Next slide. Individuals who survive a life-threatening illness, such as COVID, may be at high risk of developing PTSD. Let's be clear, though, that what may impact one person and leave them with some of the symptoms of PTSD may not be for another person. So Doug may have this experience, and it may not impact him. I may have that same experience, that same car accident, and as a result, I may have PTSD. So it depends on the person and how they're impacted. Well, researchers in China have already released some data on COVID and PTSD. They administered a checklist to 714 people about PTSD that had COVID. And they found that 96% of the participants experienced some symptoms of PTSD. I need to take a drink of water, sorry. So again, for some of us people that have been around, you may remember what I'm about to speak on. Between 2002 and 2004, more than 15,000 people in Toronto were quarantined due to severe acute respiratory syndrome, or SARS. Now, certainly, SARS was a terrible infectious disease, but it didn't have the long-lasting impact that we've seen with COVID. So those people participated in the study, and from that study, it was noted a longer lasting psychological distress, more than a month after quarantine. And almost 29% of the participants showed PTSD symptoms, while 31% had depressive symptoms. Next slide. Some of the factors that affect a survivor's mental health. And, you know, when you think about it, it really is a survivor from COVID. You know, this virus, this disease is like nothing we've ever seen. This is a year. It has shut down the economy, businesses, how Americans have lived their life. We're wearing masks. Businesses are virtual. Look, who would have ever thought we'd be doing virtual webinars? Our holidays are different. And COVID won't stop the day we all are vaccinated. The long-lasting effects, the long-lasting mental health effects are going to go on and on. The kids that schooling has been interrupted, you know, it's had an impact on their developmental levels. Older adults who have been in the hospital and people who haven't been able to visit them, or they've been in nursing homes, or people who have passed away and their loved ones who couldn't even see them but had to communicate with them through a nurse or an iPad. That kind of trauma, and it is trauma, just won't go away. It's going to have to be dealt with in one way or another with professionals in the mental health field. So the things that affect us and people's mental health during this time and after are social isolation, perceived danger, uncertainty, physical discomfort, medication side effects, fear of transmitting the virus to others. I mean, you don't want your loved ones to catch what you have. And then negative news stories about the pandemic. We found that the factors causing most individuals to experience emotional disturbances are loneliness, anger, anxiety, depression, and insomnia. And if you look at those factors, what do we think about when we think about older adults? Now, again, they're already starting out lonely. They're, you know, very limited support system. Many are suffering from depression. A lot of older adults, particularly those that we see, have limited income. So they're living in a house or a residence or group home. They don't have TVs that have all the different, you know, Hulu and Netflix and HBO. So they've got like what? Channels 3, 5, and 8. They don't have gaming systems. They don't have Wi-Fi. Now, the few phone calls they got, or even the case managers they could see face to face, they don't have that. So you've got, and if they could go to senior centers before, a lot of the senior centers closed, so it increases the anxiety, the depression, the loneliness. You're doing the same thing day in and day out, insomnia. You don't have a car, so it's not like you can drive anywhere, even just to take a ride to look around the neighborhood. And you don't have the extra disposable income to even order food to go out and pick something up. I think that's a lot of things that we typically don't think about. That's the life of many of our older adults. Next slide. So the impact of social isolation on mental health is not very good. Prolonged social isolation, like what we have been experiencing, leaves people feeling they have no control of this situation or their lives. It affects one's autonomy, competency, and connectedness. And social isolation seems to be a major factor in mental health symptoms of depression, anxiety, and PTSD. The longer the duration of quarantine or social isolation, the increased prevalence of the PTSD symptoms. And not only is the person who's experiencing that isolation affected, people exposed to or close to someone diagnosed with the infectious disease such as COVID also seem to have an increased risk for anxiety and depression. Next slide. In a minute, I'm going to be turning to Doug to talk just a little bit about some of the treatments. So eye movement, sensitization, and reprocessing. Very briefly, EMDR combines exposure therapy with guided eye movements to help individuals process traumatic memories and reactions to them. Okay, Doug.
Well, and I was actually thinking about some of the clients I have, and even if someone, well, actually, I've had two people tell me, you know, I can't get out anyway, so it's really not any different to me. But then I say, okay, how many visitors have you had? Has that changed? And what they usually say is, oh, yeah, you don't even come over anymore. So it can be real hard on a lot of us. With all this anxiety around COVID, someone said, have you noticed people having difficulty? And I said, well, yeah, I'm more crabby. I realize I have been more on edge. And so if I feel that way, other people do too. As Tam said, different people feel things differently to different degrees, but it still, I think, has had an effect on all of us. And then the assumption that if I keep myself limited, I'll be safe. Well, silly me, I thought, okay, I haven't seen this one friend of mine for a long time. We could just have lunch. And we had our masks, but when you have lunch, you take them off and you eat. Well, the next day he called me and said, oh, I need you to quarantine. I found out somebody in my office has tested positive, and so have I. And I'm thinking, okay, I just wanted to have lunch with a friend of mine that I hadn't seen forever. And it turned out he was positive, but I wasn't. But I still, I mean, that affected my family. I had to call work and say, I've been exposed. And that added a couple extra layers of anxiety on me. With these different, Tam mentioned the different treatments, which is where we are now. And she mentioned the EMDR, and there's also the cognitive behavioral therapy. Basically, the eye movement desensitization therapy, what it does is it helps to keep those disturbing thoughts from hijacking your brain. It is a therapy that has been accepted by the Veterans Administration, the American Psychiatric Association, World Health Organization. So it has been through testing, and it has been shown to really help people. Basically, when we're in a traumatic situation, and stress is part of trauma, we have our natural response is fight, flight, or freeze up. And when distress from some event remains after the experience, those upsetting images and thoughts and emotions can create feelings of being overwhelmed, and it can pull a person back into that experience that was awful. The EMDR therapy helps the brain process those memories, and the experience is still remembered, but that fight, flight, or freeze response is resolved. So you no longer have that reaction to something that could trigger those thoughts or those feelings. Cognitive behavioral therapy has been around for a long time. It helps people basically look at what they're thinking and how they're reacting, and changing the way they're reacting. So it's more focused on behaviors, whereas the EMDR is more focused on taking away the power from those awful thoughts and memories. And one thing I've noticed is PTSD seems to be highly undiagnosed. The doctors will say, "Oh, a person's depressed." Well, yeah, but when I look further into it, they're depressed because they have PTSD. It's part of that.
I
And
agree.
yeah. And I was talking to another friend of mine who does EMDR and works with firefighters and police officers and soldiers, and she said the reason why it's not diagnosed is that nobody would pay for it unless it was long term. So she said things are changing. I actually haven't seen her face to face for a year either. But as long as the person gets some treatment, I don't care if they're labeled as depressed or PTSD, but I think it really helps if they have an accurate diagnosis, because there are some medications that can be used with PTSD and different modes of therapy like the EMDR. So it can be used with people who are depressed, people who have anxiety attacks, as well as the cognitive behavioral therapy. Basically, when I'm in a situation with a client, I look to see what is going on with them in order to figure out which method would be most useful for this person. Anything else you can think of, Tam?
No, I was just going to add, I think what a lot of people hear now is specialized trauma work. And that includes PTSD, the things that we mentioned earlier. You'll hear people advertise that they do trauma work of rape, sexual abuse, car accidents, divorce, illnesses, COVID. So thank you, Doug. I appreciate it. And again, Doug does that with his work here at Benjamin Rose, and it's one of the things we do in our behavioral health services team. In addition to special modality treatments, now we don't prescribe medication here, but medication may also be used in conjunction with talk therapy. No one specific medication resolves PTSD. It's always a combination of medications individualized to the person can curb some of the symptoms. Antidepressants and anti-anxiety meds are commonly prescribed to individuals with PTSD. Next slide. Some of the simpler coping techniques that can be used are a square breathing. Again, it's a breathing in for a couple of seconds, holding for 4 seconds, breathing out and breathing in. And the idea is slowing and grounding, slowing the breathing so you can ground the person, so you can clear your mind. There's a lot of racing thoughts when you're stressed and anxious, and it's just trying to just get you grounded. Focusing on your senses to bring you back to the present. Not worrying about the future, not worrying about the past, but what is happening right now. Journaling, meditation, and redirecting negative thoughts are excellent for almost anything. What I like to suggest to people is, in addition to the daily journaling, even if it's just a sentence or two, to start a gratitude box or a gratitude bag. Every day, write on a piece of paper in the evening something you're grateful for that day. Even if it's, I got up and I brushed my hair. I got up and I saw the birds or heard the birds sing. And drop that piece of paper in the bag each day. And at the end of the year, on New Year's Eve, go through that bag. You'd be surprised how the gratitude things increase. And it's seeing how things are fuller in one's life. And can be a very powerful moment for your life. Limit watching TV. I'm a real news buff. Even I had to make sure I turned away from it for a while, because if you want to trigger a negative response, news 24/7 or waking up in the middle of the night to check the news, that's not good if you're already anxious about the pandemic or any number of things. So limit your time. Or if you have a loved one that's suffering from them, just try and focus on something else. Try and get out of your own way. Reach out to somebody else. Telephone. If you have the capability to FaceTime or do something indoors. Keep a daily structure. If it is only getting up at the same time, washing your face, making the bed, it provides a sense of purpose. And it's the little things. Ask anybody that's been telecommuting. People are starting now to get dressed up and cleaned up just because you've got to have a reason. And it applies to everyone. Next slide. So how to help? There's resources for help. If it's really serious, call mobile crisis, 211. You can always call Benjamin Rose's non-crisis service number, which is 791-8000. And you ask for intake, and you can leave a message. And this is where you can ask for our behavioral health services. You'll be greeted by someone at intake, and there you can explain what's going on. You could say, if it's either about yourself or someone else, that you've been struggling, you're depressed or worried about what's happening in the community, or that you just haven't been feeling as well, and you're really worried, and you'd like to talk to somebody about this. Or maybe you're struggling because you've lost your job, or you don't know what's happening with a loved one, and you can be connected with a counselor. You could be connected with a case manager that could meet with you and hook you up with there's a number of community entitlements, whether it's food stamps, or if you've lost your heat, or it's Medicaid with insurance. We offer a full array of services. We do it teletherapy now, based on local and state guidelines, and we've been very successful with that. As things open up again, we'll do some home visits, face-to-face visits, or in the community. So I really would encourage anyone that's just not feeling in that positive emotional state to give us a call, and we can help sort things out. And if you're a caregiver, a friend, or a neighbor, the easiest thing to do is ask the person how they're doing. If you're worried about a neighbor or haven't seen them, say, hey, what's going on? You never know. Things always look good on the outside, don't they? You scratch the surface and you find out it's not so good. Okay, next slide. So I guess I'll leave this open to any questions you might have. I know we covered a lot of material, so we'll open it up.
Yeah, we have talked about a lot of different things, and I think people should feel free to bring up questions to us. So go ahead.
Thank you, Tam and Doug. Like I said, if you have any questions, please feel free to leave them. Right now we have one question. What are some warning signs that long-distance caregivers can pay attention to when they're perhaps talking to their loved one on the phone, that their loved one might be suffering from depression or PTSD?
That's a really good question. I'd also like to mention that we have a program here at Benjamin Rose. It's called We Care, and perfect for families that have caregivers out of state. And that's, I'm mentioning that first before I give you some answers, because if you would call that intake number, the 791-8000, and ask for We Care, they'll connect you to that program that has really great services that can direct you to some things to help caregivers in that situation. But some of the things you should look for here is the person answering when they usually do. You know, if you have a schedule that you always call at 3 o'clock on Sunday, and all of a sudden they're not answering, what's the tone of their voice? Is it upbeat? Is it flat? Do they not want to talk as much as usual? I think, you know, it depends on the person too. If the person has been sick, do you know a lot about, are they keeping their doctor's appointments or not? Do you have someone that's able to look in on that person? Does somebody have power of attorney, or releases to doctors, so that while you may ask that loved one, hey, you keeping your doctor's appointment, say, oh yeah, you know, you want to be able to call that doctor, and you've got a release to say, hey, has my mom kept the doctor appointment? And if the doctor says no, you know, then you got your answer. But if you don't have a release of information, you're not going to be able to know, are you? So I think those are the red flags. And it's really important that if mom lives in an assisted living or mom lives in a house, you should get to know the neighbors so a neighbor can check up on mom. You may want to call the post office. Have they been collecting their mail? Is another way to figure out. So those are some suggestions, but really call our We Care department. They're very helpful, really nice staff. Any other questions?
Yeah, so as caregivers, how can we differentiate between depression and PTSD?
Depression and what?
PTSD.
What's the last one? I'm sorry.
No
She's
problem.
talking about, yeah, depression and PTSD.
Oh, okay.
And
Do you want to take that one, Doug?
yeah,
Okay.
yeah, I'll help a little bit with this. Depression can be part of PTSD, but the biggest thing about PTSD is when a person gets overwhelmed and they're not in the present moment. They're back in a time when they felt threatened, when they felt in danger, when they felt helpless. It's officially called a flashback, when a person is just pulled into that old experience. I had one client who basically somebody tried to break into her apartment and was pulling on the door, and she could not sleep for the next couple of weeks because when the furnace would come on, it would go click, or something else would happen, and she would hear this noise and she would be pulled back into that terrifying experience. And as far as related to the COVID stuff, being kind of immobilized and not being able to make any progress or move forward with anything in a person's life, I think that would be probably one of the indications. But the other thing to think about is you love your family, you care about them, and whether it's depression or anxiety or panic attacks or PTSD, your goal is to help them And so feel free to definitely talk to the doctor, call Benjamin Rose, call another mental health agency, because no matter what the problem is, you as a layman can see that someone needs help. Does that help?
I think that's a really good answer, Doug. That big differentiation piece of reliving the trauma versus, depression is the feeling, and you're sad and you're upset about a situation, but it's where you hear a sound and it reminds you of gunshots. You hear a rattling of the door, or you hear a voice and it reminds you of the person that assaulted you. And that is expressed in nightmares, hypervigilance, where you're startled and you're always scanning because you think that this thing is happening again. The sound of somebody being sick in the outside, somebody coughing, might remind you of the event. It brings you to the event, and that's what's different.
Yeah, well, and I also think in the context of COVID-19 and isolation, I would probably expect more PTSD to be prevalent when a person has had someone die, or when they were in the hospital for 2 weeks and couldn't remember because they were on a ventilator. That's more of where I see PTSD fitting into the COVID-19 situation. Just general anxiety or nervousness is general anxiety. It's not necessarily a PTSD, but I want family and friends and caregivers to know they don't have to have the responsibility of figuring out what the particular issue is. All they need to worry about is finding help for their loved one.
Very good.
Don't worry about, like, do I have to figure this out? Okay, because there are people to help.
Absolutely.
It looks like we had someone who raised their hand. Joyce. Are we able to unmute her, or should she go ahead and write her question in the question panel?
Oh, she unraised her hand, I think.
Okay. Okay. We did receive one comment from someone who says they use the gratitude jar method, and that's great. I'm glad that was effective for you. All right. Any other questions?
I think that's it. Okay, well, great. Thank you, everyone, for joining us today. And thanks to Tam and Doug for a very informative presentation. We do virtual programs for caregivers the first Wednesday of every month at noon. So stay tuned for our next program on April 7th. Have a great day, everybody.
Thank you, everyone. Thank you.
Thank you. Thank you very much.